Hello, everybody. We are live. We are
Hi.
almost done with the
foot.
We have started at the crown of the head, and we have gone down. We went down the trunk, the front, the back,
the
chest. We went all the way down the back of the leg, side.
The glutes.
Yeah, we did low back. We did the abdomen. We have done. We have done
knees,
hips, calves, shins.
That's right.
And we are finally down to the last two courses for the lower extremities.
This is pain at the top of the toes and the top of the foot, and next week is pain at the bottom of the toes and the bottom of the metatarsal head, the ball of the foot.
Yeah. Now, my clinical experience is that pain at the top of the foot is less common than pain in the bottom of the foot.
Yeah.
But when you have it, I have a personal story that tells you just how important it is. I actually had to miss a couple days. I had never missed school or work at all. I was just a real driven workaholic, studentaholic in high school, and I woke up one morning and I had some pain in the top of my foot, and it progressed throughout the day. I actually had to call my parents and get picked up from school.
Gee, that's pretty painful.
Yeah. And of course I went to a doctor and they had no idea what to tell me it was. They said it's inflammation of my foot somehow or something, and wanted me to take some
pain and inflammation.
Pain, inflammation, yeah. It was a footitis. And I had top of the footitis. Dorsum footitis, and then I called up a really great real old school chiropractor who knew a lot back then, and he said, no, that sounds like it's the ligaments and the tendons that run along the top of the foot from your toe extensor muscles. And he said that, and I had never heard of that, and it was absolutely true. And I did some similar things to what you're going to learn to do tonight. And I went from being unable to walk for about 2 days to walking almost just fine within about half an hour. So the muscles that pull your toes up and back, they are being used all the time. If you've ever been driving for a long period of time and had to keep your foot back like this, you might have felt some of it.
Then the correction is, as soon as you get wherever you're going, you put your foot the other way.
Yeah. And what I had done was a very weird thing. I had slept in a recliner that had my toes on the footrest jacked way back like this, and so I had shortened that muscle all night long. I had slept in that position, and he asked me, was there something funny I had done in my sleep? And it hit me. I had woken up half conscious in the middle of the night going, ow, my foot hurts, and then I'd rolled over and forgotten about it until the morning. So this is actually really critical for people that have it, and you'll be one of the only people that can help them. So with no further ado, let's learn how to do it.
Okay, so today we're going to be taking a look at top of the toe pain and top of the foot pain. Okay, dorsal, like dorsal fin, like in dorsal check.
Yeah,
you know?
Dorsal fin, right.
So, okay, so that's the back of the foot, not
so
the bottom of the foot.
The foot has a dorsum.
So this is the dorsum of the foot.
Yeah.
And the dorsum of the toes. And this is the plantar surface of the foot. So this is the bottom of the foot.
You plant on the ground.
You plant on the ground.
Yeah.
And this is the dorsum of the foot here. So we're going to take a look at so how do we treat this without it hurting too much? So one thing we could do is we could use heat, and we could use sensation, deep sensation, light sensation, and scratching. So over the same muscles we're going to treat later with a trigger point work.
Gotcha.
So we're going to take a look. So look at everyone. We have little basins for everyone.
Oh, I see. So the top of the foot's a sensitive area,
so
kind of.
Yeah. Oh, yes. Well, it sure is. It can be. It can be.
Well, there's not a lot of flesh there because.
Well, it can be.
Yeah.
And sometimes this area that we're going to be treating today, sometimes when it's tight in the upper part, it causes a nerve swelling in the bottom part. So what do we call that nerve swelling sometimes?
Is that neuromas?
Yeah, sometimes we call it. So by treating the anterior leg, we often fix the nerve such that it doesn't seem to cause the bottom of the nerve to swell.
Great.
So that's nice too.
Oh, yeah.
So there's a lot of other things we're working on today. We're going to show about how to get rid of what are we going to get rid of?
Oh, bunions?
Bunions!
Oh, yeah, bunions.
Right, bunions. Right? Okay, bunions. And what else?
Hammer toes?
Hammer toes, claw toes, and?
Okay.
Well, next time claw toes. This time hammer toes.
Hammer toes. Let's see. What else could it be?
Well, we got. So that's enough.
That's
enough stuff.
That's enough. But yeah, this is so neat. If you guys remember that the extensor digitorum, it grabs onto the last joint, and so when it pulls the toe, the middle knuckle pops up and causes that hammer effect. I remember learning
But
about that.
also
in
it's
school.
a combination of the weakness of it's the strength of the extensors pulling it up and the weakness of the interossei muscles from squeezing our toes together like this.
Oh yeah.
Yeah, so those are so we'll be taking a look at that today.
Oh, and this is so critical because every single metatarsal, when it hits the ground, it tells the body, the cerebellum, to fire different muscles for walking. And so if you have problems in the interossei muscles, boy, it can mess up your entire gait.
It really
you won't
can.
even know all the problems it might cause.
Yeah, it could cause terrible trouble.
Yeah.
So we have some guests here today, so go ahead and stand up and tell us where you came from today.
Hi, I'm Kirk. I came from Ottawa, Illinois, a couple hours away.
And he's a myofascial advocate.
Yes, definitely.
I guess that's what they call me.
Self-care
Advocate. That's right. Right.
So that's what you're calling
He's
me.
one of our First Alliance members.
And tell us who you are and
Hi, I'm Linda Sunick, and I'm a body-mind practitioner and licensed massage therapist.
you've had pain where?
I have exactly what we're talking about.
Dorsal foot pain and
also the frozen
dorsal
toe
pain.
yeah.
She's got that. So she's
Wow.
so is that interesting?
Well, then we're going to get to see a real case in action.
Yeah, we will. We will see it. Yeah.
Be
Now,
merciful.
yeah. Which side is it? Both sides or just one?
More so on
The right.
Or sorry.
Yeah.
On the right.
Okay, great.
Hi, I'm Camille, and I'm part of the furniture here.
Great. And does the furniture have any dorsal foot pain? Have you ever experienced that?
No, I had the plantar fascia that we worked on the other.
Yes.
Right,
And we want to do a
right.
little more with that next week.
I got to tell a quick story.
Yeah, okay, quick story,
I
Kurt.
slept overnight with my leg hanging out from underneath the blankets, and I woke up with dorsal foot pain.
Yeah.
It was crazy.
Yeah.
I couldn't hardly walk by the end of the day, but going through the protocol, it was gone.
It's an amazing thing. I have had several patients that's the same exact way. They wake up with it. So it's really odd. Or after a long drive. Those are the two cases that I've heard of. But yeah, great. Awesome.
Oh,
Well,
yeah, that's so true.
well, and maybe it was latent, and sleeping just activated it, and so we can always go to the muscles to see if the trigger points are latent there before it causes pain.
So one of the areas we're going to treat today is muscles that cause pain in the big toe.
Oh, right. Yeah, that's
Okay.
right. We are 37, 39, and 40.
That's
right?
it today.
Our
So
protocols?
40. Here's 40. Yeah.
Okay, here's
So we're
40,
going to
so-
start with 40. Oh yeah, thanks you.
If you have your
so
chart
the
there,
Rosetta Stone here.
here's the Rosetta Stone.
Okay, here's 40,
Yep.
and here's the muscles that cause pain, in 40. So let's find where.
Yeah,
where
these
it
three,
is.
37, 39, and 40.
And here it is, 40, and then it's the tibialis anterior, the extensor hallucis longus, and the flexor hallucis brevis. So let's take a look here. So
And
this
hallucis is another name for what?
big toe.
Big toe, right. Hallucis. That's the big toe.
Big
Okay,
toe.
Great.
So this is the front of so this is the tibialis, and see here it attaches right here. You can see where it attaches
Right in the
onto
middle of the arch there.
right onto these two bones, and then this muscle here is on the front of the shin, about halfway down, and then it comes down and attaches over here onto the big toe.
So that's a toe that extends the big toe backwards,
right,
and
that's
it goes
right.
all the way up the shin?
And this one here helps hold the arch up here.
Yes.
It touches right in the arch.
Wow.
And then here is the flexor of the big toe.
Okay.
And this
great.
is everything that causes big toe pain on the top. Okay,
Wow.
so we're gonna try to make it less painful by the thing is I'll let you in a little secret.
Okay, a little secret.
I do this every day.
You do this every day?
Almost
as
every
part
day.
of your routine? You
It's
like it?
like yeah, but I do it for my whole self,
Well,
my whole body.
I see, yeah.
Every part, so it's a stretch enhancer. So I use this one I'm going to show us with the feet,
Yeah.
but I do it for the whole body. I could do it right after my shower or right after my bath, And I warm up, and then I take the different muscles on the stretch, and then I use the scratch, the exfoliating volcanic ash,
Yeah.
and everywhere. So someday maybe we'll do a video of that.
Okay,
the bathing suit
super.
on or something.
Yeah. Great.
Okay,
so
so-
big toe pain, or
So you
top
can
of the big toe pain.
Yeah, top of the big toe.
Top
Because
of the
next
big
week
toe
we're
pain.
doing bottom.
Yeah.
Can you imagine we have a program for the bottom of the big toe next week?
Well, we better. I mean, big toe pain is actually,
Okay.
I guess they might mistake it for gout sometimes too, right?
They sure do.
Yeah.
This often, if often they've been to the doctor and they've had some treatment for that, but their toe still hurts. Often it's myofascial in origin.
Yeah, that's right. Yeah, maybe they had a uric acid problem that was fixed, but you know, the myofascial problem still lingers.
So this is what you can download off the internet. So everybody, if you can get a basin of water together, you can put your feet in your bathtub. So we're going to all get together so that we're going to treat some of these muscles. So you guys, I'm going to give you a little bit of something to use. So go ahead and put your feet in the water. Okay. I'm going to give you a little bit of volcanic ash here.
While she's doing that, let me show you the muscles and the other protocols. Here's 39.
Okay, here you go.
That's the lesser toe pain. That's the pinky toe. That's the interossei of the foot.
No, definitely go.
And the extensor digitorum longus. And then the dorsal forefoot pain, which would be right here, 37. That's where I was experiencing my pain. And that's the extensor digitorum brevis. Extensor hallucis brevis.
So sometimes you can have pain on the top of the foot because your shoelaces are too tight.
Ah, yes, right.
So that's one thing you want to check for, is making sure that these aren't too tight.
And they call that condition laces.
Lasitis.
From having your laces too tight.
Yeah,
Yes.
yeah. Now,
Yeah.
when they're too tight, does that just mean that it's pressing down on the
Yeah.
foot?
And it's activating the extensor brevis and the
By just
hallucis.
putting pressure on
Right here. Just putting pressure right on it.
Yeah, yeah. So putting pressure on something, prolonged pressure can cause
Right.
agitation. Just like the hamstrings, when you have you have too high of a chair and it's compressing on the hamstring as you're sitting on it, like a bar stool, right? Isn't that
Yeah,
the same kind of
that's
thing?
right.
Can cause trigger points from having
Right, that's the chair seat victims.
Yeah, prolonged
So
compression.
here, when we're sitting, if the chair is pressing into the back of our leg, it could be causing activation of trigger points.
So that's one way, is a prolonged pressure on it.
That's right.
Cause that. Also, tight shoes that compress from side to side, right? That make the toe box too.
So sometimes when people say, I have narrow feet, that's because they've been wearing narrow shoes.
Oh yeah.
And so just pushing the metatarsal heads together with the shoe doing that could cause you to have the excruciating pain and not want to walk through your feet.
Oh yeah, and there's really great tests showing that when you squeeze the feet together like that, you lose all sorts of strength in your walking muscles and some hip muscles, because like I said, those interossei trigger a lot of the firing of your gait muscles.
So let's take some of this nice exfoliating scrub.
Yeah, it's a scrub.
We're going to put it right here in the front,
We're using
over the tibialis anterior.
a company called Renewed. It's a friend of ours who makes it here locally.
Yeah, and they have it at the different shops that I'm trying to think of the name.
Yeah, but there are other kinds of scrubs. This one's neat
Yeah,
for
this is
several
nice.
reasons, though.
But what's nice is it's got essential oils in it, and it sticks to wherever you're putting it, and so that's nice. It's like, and it's very fine, so you can use it on your face anywhere. So here I'm using it right over the tibialis anterior, and right over the extensor digitorum.
And what is the benefit of that scrubbing action?
You can make it. It makes it. Well, you can feel the muscle underneath it, so you can just check it. But then also, it sends a message to the brain faster than the pain message, so then you could stop the pain at the gate.
Yeah.
So while you're working with it, like while you're exercising, while you're moving, while you're using it, while you're pressing in, all of that goes to the brain faster than the pain message.
Great.
So then it could make it less painful to be treated.
Yeah.
So
Also,
it might make it more fun to treat yourself.
and couldn't it deactivate some triggers in the skin if they were there?
Yes, we may see that we may find sensitive areas in the skin that we might be treating that could help to treat.
Guys, just subjective note, how does it feel? Does it feel good to
Feels
do that?
good.
Does it? That scrub
And it
feels
smells
great.
good,
Oh, it
too.
smells good too. Really
It has
light
a very
smell.
nice light smell, very nice fresh light smell.
Even if you were chemically sensitive, I think you could handle this. It's very light.
Are you supposed to add water to it?
A little bit of water, yeah.
Yeah, a little
Yeah.
bit of
The
water.
damp balm or something.
And you see, there's a little bit of essential oils in it, and that sort of like makes it into like a lather. Now we're gonna get in between all the toes.
All
So
right.
so this area here,
You want a towel here?
yeah, can we put it right here? Yeah. Good. Okay, so we get there. Okay, good. So here, so we're gonna get into the foot itself, and we're gonna work right in between the toes. We're gonna get in the interossei of the foot.
Oh, I'm getting jealous again.
Get into all the interossei of the foot. Especially this week, we're gonna do the interossei that are on the top of the foot here.
Myofascial work in the foot pretty much tops out my chart of #1 most pleasurable thing in life.
Exactly.
Right up there with guacamole and a few other things.
So here's our extensors of the
Oh,
great
boy.
toe and the lesser toes, the brevises.
Oh yeah.
They're right here. So this could cause pretty good top of the foot pain right here. So let's go ahead and let's do its job. Let's treat it and stretch it.
Yeah, we didn't show them
Treat
the
it.
extensor brevises. Is that
Well,
in
I
the-
got it right here.
It's in another protocol, probably. Let's see.
Yeah, it's in the other protocol. Yeah,
Let's see.
so it's right here. Right. So in there.
Is it that one?
But I've got it. Look, I've got the right in the book right here. So look at if you. So this is a.
I always make faces.
So the most. Okay, I'm sorry, I can't do
That's
that.
right.
This-
That's right.
Just, I'll get it out later.
Yeah. Okay.
Okay, so
But the extensor brevis doesn't go up the.
it's right
chin,
here.
right?
It
just
goes
starts
right
there.
here. So
yeah.
the extensor brevis is right here.
Yeah. Exactly.
And the extensor hallucis is right here. So the extensor hallucis and the extensor brevis is right here at the top of the foot.
And the brevis goes through all the 4 lesser toes.
That's
and
right. And the
hallucis-
hallucis comes right here to the great toe.
Yeah.
Okay, so that's what we're going to be treating today. And between the toes. So we're going to treat the interossei right here. And we're going to be treating the flexor of the great toe. Flexor brevisis right here.
That makes up kind of like the top part of the arch, right?
It helps to make this part of the arch right here. Yeah. And you want to really feel it shortening and really feel it lengthening.
Because when you get down to here, right, then it's part of the what's the bottom of the arch again? That's is that one of the adductor for the hallucis or something? The muscle that's down here. Because I get
Oh, the
confused.
adductor, yeah. So
Yeah.
here's the adductor. We
Right,
treated
there's
that
the
just
adductor.
recent. So it starts
Yeah.
right here, and we're gonna go. That would be really important for getting rid of bunion.
Yeah,
Okay.
yeah,
So if we want to get rid of bunion,
Yeah.
we want to really get the adductor hallucis to pull the great toe this way.
Yeah.
And here are the muscles right here, and you can sort of treat it while you're moving it. You can sort of feel it right here.
Yeah,
You
yeah.
can treat it while you're moving it, right there, like that.
That's really neat to see that the arch is
Abductor
made up
hallucis,
with all these
yeah.
different muscles.
Another muscle that's real important that we've been treating is the adductor. So that's the abductor, AB. So, but the adductor, which is right here,
Yeah.
and attaches onto each one of these metatarsal heads here, but it's right here and attaches onto the great toe, and you don't want it so tight that it keeps pulling your great toe inward.
Yeah, it's just amazing. It grabs onto the side
The
of each
inside,
of the
yep.
metatarsals and grabs the toe.
Right here on the toe,
Yeah.
right there, and then also right here. So it comes this way, and then also you can feel it grabbing the toe right
yeah,
there.
It's just like all up
The
and through
oblique
here
head.
and through there. Wow.
And the
yeah, it's
transverse head,
An
yeah.
amazing, huge muscle.
So those are good to. So I like this because it stays on for a long time.
Yeah.
It really smooths your skin out. If you have any cracking, it keeps the skin nice and soft so it doesn't crack. So it's a nice tool for treating yourself and
Yeah, and you
feeling
get a little
good.
bit of a pedicure while you're doing your self-care. Why not?
That's right. That's right.
Nothing wrong with being beautiful.
So yeah, and I like to do things that are fun to
Yeah.
do. You know, so if I'm going to do this a lot, it's going to be something kind of fun.
Uh-huh.
So I make it a little fun for me,
Yeah.
you know,
Yeah.
to do it fast. It's really fast. So this is how I like to take care of
Great.
treating myself, and I usually start this way, and then if I find something that's not working, it doesn't pass the range of motion test, then I start to treat that.
Uh-huh.
So that's how I start off my day almost every day. Some days I don't have time.
Some days you don't have time.
But most of the time I do.
Yeah, that's
Yeah.
right.
So I use this like as a diagnosing time or evaluating. Like I look for dysfunction while I'm doing this.
Yeah.
and see what things I can't pass, what range of motion tests I can't pass, and then I try to correct it. Yeah.
Yeah. Well, you're lucky you get to set your work schedule. So you set your work schedule so you always have time for this in the morning.
That's true. I do that.
She doesn't start at 8:30 in the morning, folks.
That's right. I don't. So I start at 10:45 every day.
There's plenty of time to do this.
That's right.
Great.
It does. It gives me plenty of time.
But you can do this at the nighttime too, you know. It's a really great thing.
Oh yeah, you can do it before you go to bed at night.
Yep.
So it's one of the things I like to do, and it makes it more fun.
Yeah.
Yeah.
Yeah. Yeah.
Let's so dry off a little bit. So I was going to go over all the muscles we're going to be treating today.
Yeah, let's look at it.
Okay, great. So here's protocol 30. So that the first muscle in protocol 37 here, the most likely one to cause pain.
Yeah, the
and
brevis
the-
extensors.
Yeah, in the back of the top part of the foot. Here we just treated them, and starts here on the tarsal bones there, and goes to the great toe,
Yep.
and goes to the lesser toes right here.
There you go.
So that's the extensor digitorum, and that's the first two likely one to cause top of the foot pain.
Yeah, and you get that L5 nerve root is what
Oh, yeah.
gives you strength in that muscle.
So let's all we'll treat this today on ourselves, but we'll look at that the nerve roots. Of course, if you keep in mind that the nerve roots L4, 5, S1, 2 practically covers the entire leg, all the feet, the
Absolutely.
heel, all the toes,
Yeah, totally.
everything. It's so
From the knee down, pretty much everything.
yeah, everything, just about everything. Yeah. So. Okay, so the third most likely causing pain at the top of the foot here is the extensor digitorum longus. So you see how it comes down here to each one of the toes, and it's in between the front part, the tibia and the fibula right there. It starts near the fibula head, and it comes down, and then down to each one of the toes.
So neat. So you've got one that's just inside the foot, and then the other one crosses the ankle joint, goes all the way up to the knee. Incredible.
And then here the extensor hallucis longus just goes to the big toe. So that starts about mid and comes down this way and comes down, and then goes here to the great toe.
Yeah, about halfway up the shin and then down to the great toe. Cool.
So that's the extensor digitorum longus and the extensor hallucis longus.
Okay, great.
And then the next most likely one here is number 5. And that's the flexor hallucis longus. So here's the flexor hallucis right here.
Or brevis? Is there a longus or
Brevis.
No.
I meant to say brevis. I'm sorry. It's right here. The brevis.
Yeah.
The flexor hallucis brevis is
Yeah.
the next most likely one here. The fifth most likely. And the sixth most likely is the interossei of the foot. So all the muscles in between the toes. So the ones we're going to be working on today will be the ones in the top of the foot right here. And next week next week we're off. We've got off for Christmas.
Next week we're off for Christmas.
And we're going to be getting our Christmas gifts ahead of time, and then,
Yeah. We're gonna beat the crowd.
and then the next time we get together, which is we'll be working on the bottom.
Yeah, you have no excuses for late Christmas gifts because we are giving you next Tuesday off.
So the flexor hallucis brevis, which is right here.
It kind of looks like the adductor hallucis, doesn't it?
Well, it looks. Here's the adductor. Here's right next to it.
Oh,
So
I
the
see.
adductor is right there. Adductor hallucis
Okay.
is right there, and it attaches right there on the big toe.
So it's the
But
flexor
this
hallucis is
the
just on
flexus
the
inside of that right
yes,
there.
the inside of it. Gotcha. Okay.
And it
Gotcha.
flexes more,
Yeah,
and then
yeah.
here's the interossei of the foot, and we're going to be working from the top down, dealing with all the ones here that cause pain at the top of the foot.
Oh, yeah.
So that's all the ones that are in 37.
Yeah, 37.
So then we're going to take let's look at next. We're going to take a look at
There's only one extra one, I think.
yeah. Here's this one here. We're going to be looking at
40. Tibialis,
39. 39.
Oh yeah, 39.
So a 39 is the lesser toe pain, and that's only one interossei of the foot. Two, I meant to say, and also extensor digitorum longus. So those would be the two that cause toe pain. So here would be the extensor digitorum longus, and the interosseous of the foot. And the last one,
The referred pain patterns just kind of look like this, right? Like
yeah,
that?
yeah. There's the referred pain pattern. Here's the this is for the great toe, and then this is for the lesser toe.
Yeah, great.
So the
it's
extensor
easy to
hellicis.
remember those.
Yeah, they go right to the great toe. The extensor hellicis goes, and then to the lesser toes, right to those lesser toes, just like that.
Right,
Yeah.
great.
And then the last one is great toe pain. So the most likely one is tibialis anterior, and you can see how that causes really bad great toe pain.
Wow, so you
So it
feel
goes as anterior ankle pain, but also great toe pain.
that must be the one that hurts when I'm driving because it's
Yeah.
exactly what I feel.
Yeah, yeah, and you get that. So often when we hold our foot up like this,
Yeah.
we're using that muscle to do it.
Yeah.
And that muscle then causes significant pain. And the answer to that then is when we get to our destination, put our foot the opposite way.
Yeah. And then
Okay,
cruise
uh-huh.
control.
Oh, okay, cruise control. That's the other
Yeah.
thing. Okay, the next most likely one to cause pain there is is in the great toe is the extensor hellicis longus here, and the third most likely to cause pain in the great toe is the flexor hellicis. So those are the ones that we're going to take a look at.
Okay.
So those are all our muscles and some of their referred pain patterns.
Great.
Yeah.
Super. So we do have some on the bottom of the foot too. The flexor hallucis and the flexor hallucis. Basically, that's it.
Yeah, well, the flexor hellicis, yes, only the flexor hellicis.
Yeah, the flexor hallucis is the only one we're looking at on the
Yeah,
bottom
yeah.
of the foot today.
That's it. Okay, so let's take a look at treating the extensor digitorum brevis and the extensor hellicis brevis. And there's this pain pattern right here. And you can see it attaches sort of on the outside of the ankle, front here on the little talus bones here.
Yep.
So let's go ahead and let's treat that. And I have some nice tools for that.
Right. And
Okay,
again,
so-
like we said, all the nerve roots, as you can see in these 3 protocols, they're all covered when you get to L5 through S2. So you want to do the finger skin rolling, and you'll want to check for all the rotators and extensors of the spinal segments in those areas.
Okay, so I have some nice tools here for everybody. So you can hand this down to everyone. We got a big crew here.
Yep.
Oh, Stephanie's here.
Stephanie joined us.
Hey.
Okay, so for this, we're gonna sometimes. Okay, so what if it's difficult to reach down like this? Then you could put your foot on a stepping stool. So
okay.
maybe if one of you guys want to get a stepping stool, we could
You can't
demonstrate
cross
that.
your leg. Can you do it cross leg?
Well, you may be able to, but it may be difficult because you won't be able to see where we're going.
Oh, okay.
So here we're gonna go ahead. Let's treat right where the muscle attaches. So we're gonna come right here, and we're gonna come just like this and press right into the extensor digitorum brevis.
Because I think it'll actually be easier for Sharon to demonstrate on a stepping stool. Well,
Oh,
for
thank
Sharon, I
you.
think it'll be easier for us to see.
Okay, good.
Yeah. Because you've got to get your books and all that stuff. And all that stuff.
Yeah,
Yeah, there you go. Oh, that's good.
this is good together. See,
Yeah, that's great.
you can see where it refers to. So you're looking for a painful spot. So if you don't find a painful spot, you can just keep moving along. But if you find something painful, then you're gonna hold it, breathe, and relax. And then let's come. Yeah, you can do that. Thank you.
There we go.
Okay.
There we go.
So here we could have our book too. Yeah, there we go.
Perfect. That looks great.
So we could go ahead. Let's go ahead and we're gonna go towards each one of the toes. So here we're gonna come this way, and we're gonna be pressing in and going towards where it attaches onto the toe.
And if they're really healthy, they shouldn't be painful at all. Is that
Right,
right?
it wouldn't hurt.
It's- I
Yeah,
mean, I think
doesn't
people
even
find that
hurt.
amazing, but it's really,
Yeah.
it really
Doesn't
can
even-
be so.
Yeah. So here now we're going to take a look at the hallucis. So here we're going to look at remove the great toe, and let's feel the great toe, and let's feel right where. So I'm going to resist and push up, and I can feel right where the great toe is coming in right there, right there. So I can feel right there, and I'm going to go right to where it attaches onto the great toe.
So then you do treat these on the stretch as well?
Oh yeah, and in range of motion. So sometimes I go like this and treat it while we're stretching it, like this.
Yeah.
And sometimes I like to shorten it and feel it when it shortens and lengthens, and feel what it's doing in all the different positions.
Yeah.
So that's a really great way to get at it and to treat it. And
you used to have bunions on that foot, right?
oh yeah, remember? No, both feet.
Both feet it
Okay.
was, yeah.
And I couldn't do this. See, I couldn't spread my toes at all.
Right.
And this toe used to be over here, and I had a huge bunion right there.
Yeah, actually, that's
So-
a great self test is
Yeah.
being able to squeeze and spread apart your toes.
Yeah, so if you can, so one good range of motion test is, can you squeeze your toes together?
Yep.
And can you spread them apart? And can you squeeze them together? And can you spread them apart? And I know I could get better and better at that,
Yeah.
but at least I'm doing it pretty good.
Oh, yeah. You should.
Other people
Yes.
do it better than me, but at least I'm doing it.
No, you did really well.
So I start feeling it in the soleus when I try to do that.
Oh,
In
well
the-
then
in the
you
back.
might. So then you're probably using some of the bottom of the foot muscles, like the plantaris. I mean the quadratus, that muscle, or some of the other muscles, because probably you're using some of the the digitorum attaches onto the quadratus muscle on the bottom, and that could cause heel pain and could might bother. So you could other muscles might jump in.
Yeah, you might
Yeah,
have
I'm
some
not
of
feeling
the.
heel pain, but I'm just noticing that.
Well, there's
know,
flexors go up the back there.
Yeah.
Flexors of the toes go up the back there. So
So-
that's probably what it is.
Okay, so
The
let's
toe
go
flexors.
ahead. Let's treat the next most likely one to cause pain, which
Yeah.
would be I think the here's the next one, the third most likely here, the extensor digitorum longus, and then the fourth most likely, the extensor hallucis longus. This here, look at the pain it causes at the top of the foot. So it could be the little muscles that we treated right at the top of the foot,
Yep.
or it could be the other muscles right here.
That run over all the way up the shin,
So for
yeah.
those, let's go ahead. Let's find the head of the fibula right here. And so for the extensor longus, digitorum longus, we're going to go just a little bit more anterior from there. I'm going to press right in there, and we're going to look for any taut bands. So a lot of times I will go like this, looking for a taut band. And I come along looking for a taut band and something painful, and I look around for a taut band.
And again, if you
Look
want to
around for a
feel
taut band.
the muscle, just extend your toes backward and feel
yeah.
where it is.
So you can feel.
Oh,
so
yeah.
you can also resist the toes and then see where the muscle is right there. So, and we're coming down. And we're going to come all the way down. Keep coming down, and we're going to go down to each one of the toes.
Still got some left over.
So let's come all the way down. One time in one of the classes, somebody had really, really, really bad hammer toes, and their toes became almost an inch longer, it seemed, during the class. And they got rid of their hammer toes during the class. It was incredible. But then they had to get bigger shoes.
Get bigger shoes.
They did. They had to get bigger shoes, but they were happy.
Yeah.
They were really happy. They were glad that they could fix their hammer toes. So we went all the way down to where it attaches onto the toe there. So that's a good place to go. Let's go a little bit to the next toe. So let's see if the tendon, so maybe the tendon gets so really tight. So sometimes you want to make sure all the fascia is nice and soft.
Yeah, of
And
course.
all the tendons are nice and soft.
Oh yeah.
And you want to have the attachment to be nice and soft.
Yep.
You don't want the attachment to be really hard.
No.
So you want the attachment to be really soft. And so here we're going to each toe, looking for treating it, and also looking for any hard spots that are there on the toe.
It grabs all the way on the top of the toe, all the way there.
Oh yeah, I think I had some other really cute pictures of these muscles. So this is a nice one. This was the great toe. Here's this one here. So here's a nice picture of it. And it goes to each one of the toes.
Two pictures of toes. It sounds like you're going to be showing your grandchildren.
My grandchildren. So on Thanksgiving, I had almost 400 people watching me make a pie. and then my grandkids.
It wasn't a Tootsie Pie.
No, it was. Can you bake a cherry pie? I made a cherry pie. and a couple more pies. Yeah. Okay, so here we went down to each toe, and then let's see if we're good at spreading them apart and squeezing them together and spread them. Let's see if we get good at getting the toes to come up and then down and up and down, and see if what we're doing makes it work better. Like, what if it didn't work as good as we wanted? So then we could go back up, you know, and see if we can treat another muscle and see if we can make it work a little better. Let's go to the this one here. Let's do the great toe picker-upper, okay?
Picker-upper.
Picker-upper. We're stop calling it the extensor. We're going to call it the picker-upper, okay? The great toe picker-upper. Okay. So let's see how good we can pick up our toe. So let's resist and push on our toe and resist and see if we can feel where it attaches up here. So see if we can feel it.
It's very
About
good.
right there.
Very good to get this toe if you have people that trip or stumble a lot.
Yeah.
This is a huge muscle for that.
Yeah, so this is the a muscle that will help us to pick up the great toe, and that would help us to not have drop foot.
Yeah, exactly.
Along with tibialis anterior.
Yes.
And of course, we want to treat the peroneals because they would press on the nerve that goes down to these muscles.
That's right. So even though we're working on these muscles, don't forget that the nerve in a certain group of the population, maybe all of them, I think, it goes, the
Right.
nerve.
The nerve goes right underneath the peroneus longus, right here.
Yeah.
And that goes down and causes a lot of the pain in the foot.
Yeah, exactly.
So here, let's make sure that we go all the way down. So let's go right down to the top of the toe, and let's really feel that while we're stretching it. I feel like after I had my feet in the water, it feels better, you know?
Yeah.
It just feels better.
Yeah.
And I am trying to make it a pleasant experience that I'll like to do it, you know, instead of something I'll hate doing, right?
Yeah, exactly.
Yeah. So here, next, I'm gonna like really stretch it. So I'm gonna feel it here, right there. Okay. Then I'm gonna really shorten it, really lengthen it, and then really shorten it and lengthen it, and shorten it and lengthen it.
You know,
Really?
another time that I have found that doing self-care is very, very enjoyable is if you wake up in the middle of the night or having trouble going back to sleep. It's nothing better than being in a dark, quiet house and doing some self-care with a little candle on or something.
It is great. Even
Super
just
great.
20 minutes. If you just did a few minutes, all of a sudden then you get tired,
Yep.
and then you fall asleep.
Yep.
Yeah.
Yeah.
So just a few minutes of taking a little bit of the edge off,
Yeah.
and then pretty soon you're falling asleep.
Yeah. Yeah. Especially people who have restless leg syndrome, then there are specific muscles that they can work on during that time. It really helps.
So you want to make sure you really get this toe to come up.
So you can benefit from your insomnia. Why not?
Yes.
Make
Okay.
the most of it.
So I just want to show one thing now
Yeah.
that we're here on the big toe. I'd like everyone to keep in mind that we can go right, really bend the toe in different ways and notice which way it doesn't want to work. And then you're going to get right on the toe and like say for instance that they have hallucis rigidus, which is a lot of times bone growing up this way, out of the toe, right out of the joint here. Okay?
Right.
So, and the toe becomes very rigid. So we
Yeah.
treat these muscles just like we were
Just the
treating.
big toe.
But in addition to that, we go right where the bone is growing. And what we're going to do is, since the bone's growing, that's sort of a good thing. Like, in other words, it's not depleting, it's growing. So we're just going to get it to grow a different way. So we're going to get it to grow in the stress pattern that we want it to grow in. So we're going to put a lift under the big toe.
Right.
And then we're going to change the muscles and work with the tissue. And sometimes in only 3 or 4 weeks, we can get the hallucis rigidus to be gone.
Yeah, right.
Now, a
It's,
lot of times it takes about 4 months to 6 months to get rid of
a bunion.
a bunion.
Yeah.
But for
sure.
this, I'm going to treat, let's all treat the interossei of the foot here. And I'll show us a picture in a second. Let me get to it. But here, we're going to get right in between the toes and treat the interossei right here.
Yeah.
And that's one way of getting rid of bunion. We're going to be in between each toe and treat our interossei.
Yeah,
right here in
because
the top.
the bone's growing where the stress is.
That's right.
And so you can loosen
change the-
certain ligaments and tighten certain other areas and
yes.
get the stress to change.
Change
its-
the stress.
Yeah.
And then the bones change because
Yeah.
we changed the stress.
Yeah.
So it's almost like, it's incredible. It's almost like you can't believe how it could change something so well.
Yeah, yeah. But
It's-
you really have to have the lift. You really have to, in most cases, have the lift. And you have to really get at this to really change it.
So we went in between the toes.
Yeah.
That was our interossei. And that was, let's take a look. That was here we are, the fifth most likely and the sixth most likely. Let's do the flexor hallucis brevis, and here we just did the interosseous. Let's do also the flexor hallucis brevis. That'll be our fifth and sixth muscles.
Yeah.
So let's go ahead and let's do our flexor hallucis, okay? So let's get right on the bottom of the foot here. Let's go right to where it's attaching here, and we're going to shorten it and lengthen it, and shorten it and lengthen it, shorten it and lengthen it, shorten it and lengthen it, shorten and lengthen. And we're going to get right here to where it attaches right onto the great toe. I just love the way my feet feel.
Oh, feet are so cool.
Yeah, feet feel so good.
25% of the bones in your body are in your feet. It's amazing.
So how's everyone's feet feel?
Okay.
Feeling pretty good?
Yeah.
So how important are our feet? I guess, I mean,
wow.
wow, right?
Yeah.
Aren't they important?
Yes.
Foundational.
So great.
Foundational.
It's so great to have good feet and making sure our feet really work. So I really feel like I really get it to shorten and really get it to lengthen. I really shorten it and lengthen it and shorten it and lengthen.
Yeah, remember, there's so many bones in your feet, and I remember our anatomy teacher saying, why do you think there are so many bones in the feet? Is it because it needs to move in that many directions? Or is it because each of those bones sends a signal up to the cerebellum to tell you where your weight is shifted? All those little different joints between all those bones, they barely move, but they do sense pressure. And that pressure then communicates to the cerebellum and tells you where your weight is shifted so you can walk and not fall over.
So the seventh most likely one to cause top of the foot pain, and one of the most likely ones to cause big toe pain, is this tibialis anterior. So here it attaches to here just below the kneecap, down, 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 and then here onto the metatarsal head here, and
right at the center of the arch there, pulls it right
okay.
up.
So let's go ahead and we're going to take a look at that one. So here let's find the tibia, the shin bone. We're going to come just at the side of it, right there, and that's going to be our tibialis anterior. So we can go ahead and press right on it.
So the extensor digitorum is a little bit to the
so the
outside?
extensor, yep. So it would be like, so for that we found the fibula bone,
Yep.
or and then we
Fibula
went,
head,
and then we went there.
Yeah.
So now we're finding the tibia
going off
going
that way.
here.
Yeah.
Yeah.
Great.
So that's how we're thinking about it.
Super.
And then we're going to come down. And
It's
then
like
we could,
functional anatomy. We were taught anatomy, to be able to identify it maybe on a picture in a book, or maybe even on a cadaver, some of us. But to be able to palpate it, to be able to identify it underneath our fingertips, that's way different.
Isn't that great?
Yeah,
If
it's
we can do
really
that?
cool.
Yeah.
Yeah.
So a lot of times I'm doing it partly because I can see what the muscle does, and then I like to feel it doing its job. So then I can feel whether it's actually doing its job. So sometimes people tell me what kind of operation that they're going to have, and then I'll think about how we might be able to do it with our fingers and our hands and our tools, and how we might be able to do something this way.
Yeah.
I just had someone come in yesterday with that kind of problem, and we were able to fix it.
Which kind of problem? Sorry.
Well, they had a problem with drainage, and they were going to have possibly an operation. And we treated it, and immediately it went away. Yeah. So it was like and they hadn't thought of doing that.
Yeah. Right.
Okay. Next, we're going to come down. Let's come down where the tibialis anterior attaches. We're going to come down here, right to where it attaches.
Yep.
And you can see it right there.
Right there.
So it's right here on the metatarsal head, right there.
Yep.
In the cuneiform.
Okay,
so here.
navicular and cuneiform, or is it
Just
something
the-
like that? Yeah. Or a little bit, past the navicular, it's the cuneiform, the first metatarsal head of the cuneiform,
And we're getting right on it.
Yeah, we're literally out of touch with our bodies. I mean,
So it's good to feel
Yeah.
like this attachment should be nice and soft,
Yeah.
not hard. And so it should be nice and soft and flexible. So I'd like to get right onto it and feel that attachment and like make sure that that attachment is really soft and flexible.
Uh-huh. They say the key to any relationship is communication, right?
Yes.
So your brain and your foot communicate all the time. Would you like to be in on that conversation? Yeah. And if it's not going well, have some input and some corrective input.
We might have some corrective input to put in.
Exactly.
So, wow, what if the pain that you had is all gone now? That would be great, right?
Oh, it'd be super amazing.
Right? So we treated this so this attaches right here, and then you can feel it over here, so you can feel here we're stretching it, there we're contracting, stretching, contracting it, stretching it, contracting it, stretching it while we're treating it, contracting it, stretching it, just like that, and coming across.
Hopefully you guys are just starting to do that second nature now. Whenever you have a muscle under your fingers or under your elbows or whatever you're using, you're also stretching it, moving it through its range of motion. Hopefully that's becoming habitual now.
Yes. So we did treat that, and then let's take a look here. We did treat all of these. We did that. So I think we did all the muscles. I think we did it.
I think so. Let's
Yeah,
see.
we did them. I think we did. Yep, we did it. We did it. You guys, we did all the muscles. Can you imagine? Okay, so I was going to, so why don't we go ahead and do a little bit of what we get our before we put our shoes on, let's do a little bit of really good range of motion that we do without shoes, okay?
And then maybe we could talk about toe spreaders and lifts or whatever, you know.
Yeah. So
You
here.
can never go over that
So-
touch of lift enough.
So let's go ahead and so some of the movements that we'll want to do is we're going to want to do this. So it's everybody, you can do seated. That's good. So you want to go ahead and turn your foot this way. And we're going to want to turn it that way, right?
Yeah.
So that's good. So this is going to be one important thing. You're going to turn it and turn it. And for the extensors, we're going to want to have your foot upside down, right? And you can do that upside down. Standing, but you could also do it seated, and so you could do it more onto the great toe, and then more onto the lesser toes, more onto the great toe. So we could go like this, shorten it and lengthen it. So we go different ways. So let's do just the great toe, and let's do the lesser toes. The great toe. The lesser toes, stretching our peroneals and all of our interosseae. Let's spread our toes. Let's squeeze our toes together. Let's spread them. Let's get the toes under, toes up, under and up, under and up, and spread the toes. Squeeze them together and spread them. Squeeze them together and spread them. Squeeze them together and spread them.
Surprisingly, surprising amount of mental effort. That one little motion.
Can we do the other foot now?
Okay, let's do the other foot. Okay, let's go side, 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 side. So we get the edging. Let's have our foot go upside down, and upside down, and upside down. And just hold it. Let's do the lesser toes, stretch them. The greater toe, stretch it. The lesser toes, stretch it. Greater toe. So let's contract and stretch. So great on the greater toe, on the big toe, big toe, big toe, lesser toes, lesser toes, lesser toes, lesser toes. And let's do this way, and upside down. And this way, this way, this way. Okay, we're going to spread the toes apart, spread them apart, and squeeze them together, and spread them apart.
Try not to have an aneurysm.
Spread them apart, squeezing them together, and spread them apart.
Don't grind your teeth.
Okay, spread them apart. Good. Squeeze them together, and squeeze them under. Take them up, and squeeze them under. Okay, so let's see. Each time you treat it, so this one here, you can see after you treated it.
Yeah.
Can I spread the toe better
Yes,
now?
totally.
Yeah. So after I just treated it, I can probably do a better job. See, the one I didn't treat, I probably couldn't do as good. So let's see if I treated it, could I do a better job? See if I could spread the
Yeah,
toes
because
better.
you can do better on this
Yeah.
one than the other one.
Yeah, I can't. Yeah, this is So I treat that one, and then I get a little better. So each day, I try to make it good. You know, get my day going.
Yeah.
Right. Yeah. Get the feet working.
Yeah. Start your day off on the
Start my feet good.
right in the right foot.
Yeah. Okay. So let's go ahead. Let's put our shoes back on, and let's go. We can take a little break, Justin, and we'll go into the other room,
Okay.
and we'll go ahead and do a couple more.
7:16. Okay. So we could take a break, or we could. It's about 7:16, so we could take a
Yeah.
break
So
now.
why don't you
wanna do
take a 10
break?
minute break now?
Okay,
and then
great,
we'll go the
guys.
other-
Take a 10-minute break, and then let's set up. So 7:27. 7:27. Right? Am I doing the math right on that?
Yep.
Okay, 7:27. We'll be back.
They won't come over to that big little hammer. Big little hammer.
Yeah.
What is the specific direction that you want the muscles to go in to reduce the raise? You know where you said where the bone is raised? How should I be redirecting the muscles?
Yeah, yeah.
I want to try and memorize specifically, so I can repeat it in there, so I can tell you I think, I couldn't do this at all.
Exactly, yeah,
No.
yeah. Okay, so what you want to do is you want to come right along the bone, and you want to come like this, and you want to get right, see, the thing is the part that makes this muscles that are growing here is this thin skin that's on over the bone. And it attaches there, and if that thin skin is pulling hard, then it makes the bone grow. So what if you make that thin skin, so forward, so it's just you're pressing, well, it's not, you're doing it all different ways. Like, you're here, see, I'm trying to get it to go this way. You see how I'm making it go that way? So can you sort of feel?
Yeah, oh yeah,
See,
yeah.
see it's going, I'm making it go every way. Okay, you try.
So every direction.
Yeah,
Thank you.
yeah,
Because I couldn't see it specifically what you were doing, so I was just
right,
making
right,
it
right,
go whatever direction I could,
right.
you know. But the one that's hardest for it is the top part.
Yeah, but remember the extensor helicis, the extensor, yeah, right here. So we could go, and then come over here. You feel it right there? See? So in other words, part of it is this muscle here has to be pulling on it, Okay, and the other is this brevis, extensor brevis has to work. This extensor brevis.
Everyone around us has a song we're singing. It's a gift residing deep within the soul. Everyone is different, and everyone worth hearing. Listen to your own again, and it will make you whole. Let it make you whole, and let your music play.
Kids are like,
If you help someone's back pain, they'll be your friend for life.
she trusts me more than the guy that's
Yeah,
usually
that's
doing
good,
it.
right?
My Jesus, my Savior, Lord, there is none like you. All of my days, I want to praise the wonders of your mighty love. My comfort, my shelter, tower of refuge and strength. Let every breath, all that I am, never cease to worship you. Shout to the Lord, all the earth, let us sing. Power and majesty, praise to the King.
Speaker down here that.
It doesn't work.
Nice little speaker.
And then there's a schedule, first visit, how much is that? First visit for?
Well, if she comes in for an hour and a half, it'd be $270. No, which just sounds like it might be a good idea based on what you said, but it would be great if you came in and you learned what to do with it. And maybe you could audio tape or videotape it, and then you could keep working with it, you know,
One or the other, both of their daughters.
could come.
Yeah.
Yeah.
Girlfriend's a nurse, right?
Oh, great.
Yeah.
Well, that's great.
People,
Well, that's so sweet.
I have something to tell you.
So she can learn, so she can.
In this hectic day to day, it's easy to lose track of things of soul importance while scuffling with the back. Yet a harmony of karma we have buried in a song waits within each heart of hearts for us to sing along. Life's a simple tune in a simple key. No need to make it harder than it has to be. Just raise your voice to heaven. No better day to start. Life's a simple tune if you sing it from your heart.
Bushy bear.
Complicated if you must.
Really happy that
Fill your head with questions why.
really feel great about going on.
Second guess yourself each day.
People ahead of me.
Prod and analyze. But in the end, I swear, my friend, it never tried to hide the song you searched for all along was always right inside. Oh, life's a simple tune in a simple key. No need to make it harder, oh no, than it has to be. Just raise your voice to heaven. No better day to start. Life's a simple tune
That's it. That's the only
when
one.
you
It's
sing
only
it from your heart. It's your song and it's my song, for it's the song we wrote. Oh, so many lifetimes past, so let's sing it note for note. Life's a simple tune in a simple key. Oh, yes it is. No need to make it harder than it has to be. Just raise your voice to heaven. No better day to start. Life's a simple tune if you sing it from your heart. Life's a simple tune. Oh yeah, in a simple key.
It's rolling to people's
No
bedroom
need
and,
to
like,
make
set
it
the stage
harder
and pull the curtains and the the lights out.
then it has to be.
Like, I mean,
Just raise your voice to heaven.
Yeah.
No better day to start. Life's a simple tune.
Okay.
If you sing it from your heart.
Okay.
Life's a simple tune. In a simple key. Oh, yes, it. No need to make it harder than it has to be. Life is a simple, so very simple tune. If you sing it from your heart. Life is so simple, so very simple.
Okay, that was a little bit of music by Ed Tossing. We had a little interim music on one of the videos, and apparently, I guess it ended up going to some Led Zeppelin, and we got that video got muted because we played a Led Zeppelin song. So now we're only going to play originals. My dad's not going to file any copyright
Dad's
complaints
not gonna
against
do
us.
that, right? Okay, so
No.
we've got 3 major motion tests we're going to do today.
Only
Okay.
3. What a simple.
This 3 major ones.
3 major.
39 one. So bent knee dorsiflexion. Then we're going to do the standing heel down squat.
Okay, which is for which?
Oh well, this you can see right here that the this is for the flexor hallucis longus, for the flexor digitorum longus, and for the soleus that would be the bent leg one,
Right.
and for the flat feet knee bend is the soleus, but also some of the other
Yeah.
muscles in the lower leg, and also the tibialis anterior stretch, which is for the tibialis under the extensor hallucis longus and the extensor digitorum longus, but also we get the brevis is the hallucis brevis and the extensor brevis.
And of course, all those little ones that you're doing, moving every single
Yeah,
toe,
yeah,
every
we do
which
them all.
way,
We do
right?
all.
I mean,
We
you
do
got to
it all.
make sure every joint moves every
Yeah.
single direction.
Yeah. Okay, so we're gonna check everybody's standing squat. So let's go ahead. We'll test you first, and you could test Linda,
Okay.
and I'll test Kirk.
I would think primarily if someone came in with, local foot pain, that a lot of times we would be doing your palpation tests like you're doing. Some of
Yes.
these. I mean, this is definitely more
Okay,
for the
so
soleus than it is
turn
for.
around a little bit. Okay, so he's got his shoe inserts in, so that'll help him a little bit. So you're gonna do your squatting, and you're gonna keep your heels down. So you're gonna squat.
Yeah.
Okay,
Good.
here. So here we go. So that's 13 inches.
Not too bad, my
Yeah.
man.
Okay, you go ahead. Go ahead and test Linda. Oh, that's outstanding, Linda.
Wow.
I couldn't
Linda,
do this at all before.
You couldn't do this
think
at all. I
think
remember.
I was like 18 or 19.
Yeah,
So that's
exactly. Look
about,
at you
what's that,
go.
about 12? 12?
About a 12.
12. Like she did 12. That's really great.
Excellent. Yeah, I couldn't do it before
Super.
my inserts at all
Okay.
either.
I have to
Wow,
hold on.
super.
Oops, you're stuck.
Let's go check her.
I gotta keep my heels down. Oh, that's the problem.
Let's check Stephanie.
No, but you're
You're not supposed to do
yeah, you're not supposed to lean on anything.
Oh,
Just-
well,
just do it
otherwise
without-
I'll fall over.
Well, no, then you're going too low. Go to the point where you can't
Just,
fall
yeah,
over.
just
So that's your test then.
that's right
Okay.
there.
Yeah, that's what it
That's
is.
That's it.
Is this right?
Yeah.
17, 18?
Yeah,
Okay.
that's it.
Okay,
So a
Stephanie?
lot of work there, right?
So this is without your shoe insert,
good.
right? Okay. So without her shoe insert.
That
she's
shoe
gonna-
inserts.
Okay, here we
Oh,
go.
pretty good.
Oh,
Very
oh,
good.
Wow,
See?
it's almost all the
Okay,
way
so that's
down.
6 inches.
That's pretty much perfect.
Okay, 6 inches. Okay, so that's pretty good. Okay, so then another test that we're gonna do is the bent knee dorsiflexion, and also, so if I could have a model, we're gonna do that for next here.
You wanna be the model because you have this toe stuff.
Okay, yeah. Should I take my shoes off here?
Oh, here, take
So
that.
bent knee dorsiflexion.
Okay, so we're gonna have you lay on your tummy, just without my body supports. Just go ahead and lay on your tummy. Oh, for some reason it's not working. Okay,
I'm not like that girl that just flew on the table.
okay. Okay, now it's working.
Remember the one that was here 2 weeks ago? She just flew on the table.
She just,
She was really short. She just flew up
She
there.
did that. You're not doing that.
Okay.
Okay, go ahead, lay on your tummy.
And again, normally this is a very big one for soleus, but also
So
you're
here
going to be able
first you
to.
put it at a right angle,
Yeah.
and then you're trying to get about 20 to 20 degrees of dorsiflexion.
Yeah.
So here, that's a little bit stiff, but not
Not
horrible.
And it's primarily soleus, but also some of the foot
mhm.
toe flexors.
So that's there. Okay, let's have you go ahead and lay on your back. Got you moving. Okay, so we're going to take a look at the tibialis anterior, and I can feel it's a little stiff. And then when I go there,
yeah.
so she feels it
Some
immediately.
pain too?
Yeah,
So this tibialis anterior on
Oh,
the left,
you do
she's
have
got
it,
dysfunction.
yeah. Or the right.
Oh, right, I meant to say.
Yeah.
And
I've got some dysfunction.
and
on
here
this
too,
side,
very much here.
Oh, yeah, those
very
are-
much there. Okay. Ooh.
This is the one where I had the ankle, the severe ankle sprain for
Okay,
over a
so
year.
this would be remember it causes
Yeah.
great toe pain and top of the foot pain and pretty good ankle pain right here.
And can we say something about injury? You said you had a severe ankle sprain. I mean, what happens in injuries is memory gets trapped in all the little spindle cells, all these mechanoreceptors, spindle cells, Golgi tendon organs, all these little mechanoreceptors in the joints and muscles, tendons, and their attachments. Every single one of those mechanoreceptors has the ability to store memory. And so it remembers the injury and the trauma, and unless you work through, I mean, literally, you have to take this foot and ankle and comb through every single attachment and origin. You have to work every single one for the toes, the foot, the ankle. And when you you find any painful attachments and muscles there, you work through it, and that will completely rehab the foot. Just doing rehab the way they do at PTs a lot of times with stretching and exercises doesn't change the memory. So that is really important to get in there and work all those trigger points.
Okay, so here
out.
we'll want to look at let's look at the tibia, the peroneus longus, and let's look at the heel inversion
It's
and
just
eversion.
Really, just you can see.
Inversion, eversion.
Yeah.
Okay.
Yeah.
Okay, so let's take a look at these muscles that we're working on today. We'll look
Yeah.
at the tibialis anterior.
Yeah.
We'll look at the extensor of the
Digitorum.
toes, and we'll also look at the extensor of the great toe
Okay.
and the brevis right here. So
Absolutely.
treat those today.
During a sprain, you can almost guarantee those plus the peronei are going to have some injury remnants.
So here I'm going to put it slightly on the stretch. So I'm just going to put it just moderately on the stretch while I'm treating it. So here I am feeling the tibialis anterior and a little bit of the extensor digitorum. How's that feel?
It's okay. I mean, I can feel it, but it's not painful. It just
And-
feels tight.
Mm-hmm.
Yeah, you guys can do so much. I think that this work is the absolute most significant thing you could do to recover from injuries. I had a soldier come in. Actually, it was a
It
friend.
feels sore there, yeah.
Right here, yeah. So this would be where the extensor hallucis begins. right here, about
Exactly, yeah.
Mhm.
I had a soldier come in. He was dating a friend of mine's sister, and he had hurt his shoulder in Iraq from carrying those huge, enormous backpacks. I mean, they're just like... They're
80
like,
pounds?
yeah, they're like 80 pounds, and you just carry them all day. He had hurt his shoulder so bad he hadn't been able to lift it. He was given a release of duty because he was so badly affected by it, and at least I think that's pretty much why he was home. But we fixed it in one visit, and I'm telling you, it was just a visit at his friend's house. It took about 7 minutes, I think, to fix it, because it was a deltoid origin insertion that had one Golgi tendon organ that was still remembering the injury, and that's all we did was work on it. It was sore as the dickens, and then it let up right away, and then his pain was gone. And
Okay, so we're gonna look at the brevis and the for the extents for the big toe, and for the brevises for the lesser toes.
Yep.
So
Yeah, I haven't worked on this big toe,
yeah, well,
and that's where the sprain is at.
you're going to find nobody's worked on it because it's so tender. Oftentimes they just avoid it. They have that if it hurts, leave it alone type reaction, which we show is the exact wrong direction to go.
right,
Right.
we have to
If it
challenge
hurts,
it.
If it hurts, make it function. Yes.
Make it do its job.
Make it do its job. Stop complaining. Now, the first 72 hours to a couple weeks, of course, there is real injury. But not now, there's not.
Well, okay, but the thing is really, when we finish this series in March, after that we should go over how to do acute injury treatment,
Yeah.
because a lot of times if we do the same things we've been doing with this chronic pain,
Yes.
if we do the same thing, we could sometimes get rid of acute injury within 20 minutes.
Totally.
Yeah.
Absolutely true.
So it could be like incredible fast.
Yeah, and nothing else going to do that. Exercises and stretching is
Oh,
not going to do that.
Right there.
And
Right there.
you see that spot? That spot is sending the wrong information.
Yeah.
It's telling you that there's an injury when there actually is no reason for it. So that
Bend this knee a
spot
little.
needs to not say that ouch anymore. And that's
So
where
here's that. So that's our little extensor here, the little brevises that go down to each one of these toes.
it's acting like she just had the sprain yesterday.
Right. Yeah,
You know,
Yeah.
it still remembers it.
Mm-hmm.
There's an interesting
So extend
technique.
it.
Even though it was higher up in my ankle.
Mm-hmm.
Well, where you felt it, yeah, but there's no way to bend the foot down like that. It was an inversion roll, right?
It was freaky. I mean, I went down on the ice on my coccyx. Yeah, right there.
Yeah.
And my leg was like this.
Yeah,
It was
an
going
inversion
in.
roll,
It
yeah.
was going in a different direction.
Well, there's no way to not have set and stretched really fast the extensors there. No way. We wrote an article about this called nociceptive. I can't remember what we call it. Something about nociceptors gone wild.
We did.
Because these little pain nerves that tell your brain, don't use your foot anymore, don't move this joint, they sometimes get stuck that way, and it's unnecessary to have that nociceptive input. And this is I'm telling you, the only therapy that goes right into the place it hurts and says, nope, you're going to
Now,
function.
is this the one where you had the halicis rigidus?
No, it's the other
The other
other
one?
one, but
Yeah.
it's happening on the side too.
Okay, so the thing is right here, I'd like
Whoa.
everyone to be aware of this. You see, there's a thin skin that attaches onto the bone right here. And if we get that thin skin, that the fascia that's around the bone, the periosteum, if we get that thin skin to soften up, then it stops pulling on the bone, and then the bone stops growing there. So what you want to do is get right on there and really work with that fascia that's right over the bone, and get right in there, and you're going to change the bone. It like recreates the bone.
Yeah,
It's incredible.
awesome.
So we want to get right in there and work with it. And sometimes, so that the halicis rigidus, the bone starts to grow up right from here, and that's partly because they put too much pressure on the great toe joint here.
Right.
So if we put that first metatarsal lift underneath there, and then we start to change the tissue right here after a while, and also change the muscles that are pulling the great toe this way, pretty soon we've changed the great toe. Yeah.
Yeah, and daily, right? You
Right.
need to work on it daily.
Okay, so I did see that this halicis rigidus sometimes goes away in only a few months,
Uh-huh.
but sometimes it might take 6 months. 4 months you might see it. It's pretty good. The bunion takes longer. The halicis rigidus sometimes goes away quicker.
Yeah.
So you just have to see. In your case, sometimes even when the bone's starting to grow right out of the skin,
Yeah.
it's starting to just grow like a crown out of it. Even sometimes after 3 weeks, it's almost half gone.
Wow.
So it really makes a big difference.
I have a high instep bone right here.
Yeah.
Same thing.
Yeah, we could change if we change what attaches to it. So that what attaches to it
Would be
is
there.
the halicis brevis here.
Okay.
And if we made that like really shortened it and lengthened it and shortened it and lengthened it and got rid of what attaching, pulling up on the bone, a lot of times then that's
That's
change.
right,
That's the
yeah.
big change. Yeah.
Okay.
Yeah. So we'll take a look at that. Yeah. Okay. So that's coming along nicely. So here would be also if we want to get rid of hammer toe, we're going to take a look at the extensor longus.
Whoa.
Oh yeah,
That's
you
too
notice
much for
that
me.
a little bit much there?
Yeah.
Okay. So we're just going to take it to just where she notices it, but not too much.
On my toe is too much. You can,
Yeah.
You can do it up there.
But I want to stretch it from down here.
Yeah.
So right here, so I'm feeling, so find the fibula, come a little bit anterior to it right there. And so right while we're pressing on it, okay, so then I'm going to shorten it, and I'm going to lengthen it, and I'll shorten it, and lengthen it. I'll show us a nice picture of it here in a second. Let's see, where did I put it?
So you could hear when she said, whoa, like when you got to a certain amount of toe flexion, she said, whoa. So that, you know, that means that some
Yeah, I
nerve
think it-
in her toes.
But look at it, just went 3 times further than what you said earlier. I'm just saying. It's just, see, it's going way down, yeah. So it improved like a whole lot while we just did that. Let's see.
So is this also helping my ankle? Not be
Well,
so
those
stiff?
words, just listen to the words. I can't take that. Like those kinds of words. I mean, that is a self-fulfilling prophecy that the nerves, not you, that the nerves in your foot have set up. They've set up a self-fulfilling prophecy by saying, no, don't do that. They have made themselves rigid and unable to do
So when
it.
we first did it, I moved it about this far, and you said, "Oh, I can't go any further." Okay, then as I was going along, I went way, like maybe 3 times further, and then you said it. So I'm just saying, it improve. It's as we're treating this muscle
Oh,
right
yeah,
here.
that's a good spot.
We're making it longer. Okay.
Yeah.
And so then,
Whoa,
as I'm
yeah,
making
yeah,
it
yeah.
longer, your toe goes much further. You see? Yeah. See, it starts to go really far. So that's why it's better to treat it while you're moving it, and then you can see the improvement you're having. See?
Yeah, so yeah, it's totally different than when she first pulled on it. You can see how much motion it's got now. Yeah. And you can get to the point where it stops saying whoa altogether.
Yeah.
And that should
Doesn't
be your
take too
goal.
long. Yeah, it doesn't take too long. And then you could go down to each one of the
Oh, of course.
to the toes.
Every single attachment point all along the metatarsal
And then
heads
come
and into the phalanges.
right here, and we could come all the way down into the
Whoa.
toe.
Yeah, that's really good.
Yeah, and it go right where it attaches there.
You know, Sharon, we could show them the muscle testing too. The muscle testing
yes,
is
can
so
we do
easy.
that?
Yeah.
Oh, let's do it.
Yeah.
Oh, to know what's switched on.
Let's do it. Well, let's see what's because another thing we're going to test not just range of motion but strength.
Like you can even do it now before you work
Let's
on
do it.
those
Let's do it.
individual
Let's do
toes.
it. Let's go ahead.
So just think about which way the muscle moves. So bring this toe back up like that.
Welcome.
Hold straight back, and I'm just going to
It's your
push.
first time. I'm
Okay.
Perigo.
Good. Okay.
Okay, good.
And then pull back at the second toe. Pull back at the second toe. Ooh, nothing. You see? Pull the second toe back and up. Look at that. Nothing. I mean, it
Oh,
can't.
it's weak.
You see that?
Yeah, and
See-
that's the one where it felt
Uh-huh.
so painful when
So-
you were
Yep.
pushing it down.
So now let's just put some pressure on the interossei here and pull up, pull back. And we're getting about 20% strength. So you can pull back. See, pull back.
So it improves
See, you can get a little
by
flinch.
treating the,
Yeah. Whereas before,
Interossei.
pull up.
Whoa.
Yeah. And well, already, see, pull up.
Mm-hmm.
Yeah. See, it doesn't. See, now there's no more fling back. So this interossei muscle needs to be treated, right?
Yeah, the interossei. Yeah.
Okay. Now, not just flexion, but not just extension, but flexion too. So curl the
there.
toes down. Curl the toes down, and I'm going to pull them out. Curl them down. Pull them out. Okay. They are much stronger flexing, but not very good at all. Pull down. Pull down. Yeah. So I shouldn't be able to uncurl them as much, but it's a lot better. And this one is especially weak. Just curl this toe down. Curl this toe down. Second toe. Oh, you can just see how it feels right up.
Sounds
See,
like I can't.
This second
my-
toe.
So
My brain
you
is
don't-
doing it, but my body
So
is
that
not.
you don't have flexion or extension of the second toe.
Some nerves in here, so one of those mechanoreceptors is lit up in this toe, and it's telling this toe not to fire, not flex, not
so
to
it could
extend.
be it could be the flexor, the extensor, or the interossei,
Yeah,
or maybe the nerve root.
absolutely. But and the way you can test is you can push on some of those toes and then flex the toe down, next toe down.
So that's already telling us. Yeah.
It's already giving it more strength to pull down. So you can tell that there's at least some local problem here.
So let's treat a few more of those things and then retest.
Yeah, and then how about the toe down,
Okay,
down,
good.
push, curl the big toe
What am I
down,
supposed to do?
curl the big toe down.
okay.
Yeah. Oh, sorry, down.
Hold
yeah.
it down.
Yeah. Okay, so that works fine. It perfectly
The
loves
flexor's
that.
working good on the big toe.
Yeah, big toe extended back. Pull the big toe back.
Towards your nose.
Okay, good. Big toe is good. How about holding it this direction toward
Go
the
in-
push inside?
Go
Where am I
medially.
going?
Go.
Medial toward the other toe, toward the other foot. Now I'm going to push. Oh, see, just
No,
spongy,
no push.
spongy.
No.
So that's the adductor,
Adductor.
right?
Mhm.
So if we work in the
Adductor.
adductor in here,
Mhm.
just stimulate it a little bit here. That's the,
Then try it again.
yeah, and then try it again. Pull. No, something's still not there. So maybe the brevis one. That's right. Or, oh, I'm sorry. That's the adductor, right? So the adductor. Well, so you'll have you work on those. And this way, keep it that way, and I'm going to pull it out. Okay, it does like to pull in, so the abductor is working just fine. But the adductor, push toward the, yeah, it just flops in.
The
See?
adductor is not working.
The
the adductor is working.
Oh, sorry. Adductor
Yeah.
is working. Abductor not working.
Yeah. Mhm.
So that could be a weakness of the adductor. I'm sorry, abductor, or it could be a tightness of the adductor. Could be the adductor being tight and pulling it and shutting off the abductor. So that's how you do the toes. You can have a pinch. You can have them hold these toes apart. Hold the toes apart, and I'm going to pinch them together.
Pinch them together.
See,
Okay.
too easy to pinch them together.
Really easy.
Hold them apart.
Pull them apart.
Those ones, just ridiculously easy. How about the last two? Pull apart. And this one's weak, but the pinky toe, look at that. That one, ooh, it likes to, see, abduct. Yeah, that one likes to abduct, right? Am I doing that right?
Mm-hmm.
Okay.
Correct.
Sorry. Okay, and then, it could be different on the other toes. So spread the toes on this foot and hold those. And that one's weak, but the second toe's a little better. So, you'll find that each one of those toes should become strong in the extension, flexion, and adduction and abduction in all directions. That's how you test the toes. Simple as that.
Wow, is that great?
Yeah. In the fingers, you can do a fun test just as a little bit of comical relief. In the fingers, for pinch this between your fingers. You can have them pinch the finger, and you can see if they can hold a piece of paper. And if you really, see, she can hold it. If you really want to,
Interosseous.
that's how you
hand.
test the interosseous of the hands. And if you really want to make it comical, you can put a $100 bill there.
Oh.
And this is why you can't hang on to any money. If we work on the interosseous of your hand, you'll be able to hold on to money better.
Put a $100 bill.
We won't only charge you $1,000. But yeah. So that's how you test the toe muscles, just like
Okay,
that.
so on the same foot, let's take a look at the nerve roots, and then we'll take a look at treating also the
Okay.
interossei, and also so for the interossei, it would be S1, S2. So I'm going to take a look at. I can take your. I'll just. Yeah.
So she's
Okay,
gonna
so I'm
work
just
on
going
the.
to take a look at S1.
Okay.
So I'm going to take a look right over the sacrum. Look at multifida rotatories,
Yep.
and let's see how's that feel right here.
Tight and sore.
Kind of tight and sore. So I'm just going to
Yeah,
push
right.
up.
Yeah, right there.
So I'm
It's the
using
first spot.
like Jin Shin Do kind of technique where you're coming up like this and you're pushing up with your hand. So I'm pushing up on the nerve root S1, S2 right now.
Great. Yep, because of course those toes may not have nerve supply, and that's why they're weak.
And I'm going to go up here to L4, L5. Okay, push towards me and relax.
My leg?
With your
Yeah,
leg, yeah.
yeah.
Push towards me and relax. And push towards me and relax.
And you can just imagine how much better her feet will feel and her body will feel if all those toes were doing what they're supposed to be doing.
And push. And this goes over to the tibialis anterior. And push. And relax. Okay, so let's take a look. We're going to treat the interossei of the foot.
I had no idea they weren't doing their job.
Oh, they weren't. They really, not at all. I mean, yeah.
So I'm going to spread them apart and treat between the toes.
You just keep working on this until those things don't hurt anymore. And when they
Oh,
stop
yeah,
hurting,
yeah,
you feel it, right?
So I go towards. So I'm going towards the great toe here. So I'm going towards the great toe. Towards the great toe. Then towards
I feel
the
like there's
second
poison
toe.
in there that needs to be squished out. Like I have
Right. Almost
you
like a
know,
hot burning
yeah,
pain.
hot burning call,
Oh,
like a
gosh.
snake bite or something.
Exactly. I would say every muscle attached to that second toe needs to be worked on. I mean, it doesn't.
That's it.
It wasn't
That's it.
doing anything.
So we're gonna go between the second and third toe here.
Yeah, I can feel it, but not as bad.
Yeah. So towards the second toe.
That second
so-
toe didn't want to do anything.
So a lot of times I put another something underneath the foot while I'm treating. So often I'll treat with something else underneath. Get a hold of something. Oh, let me get. Okay.
Also, for inner SCI, you can use toe spreaders that keep the toes apart.
Yes, we can do that too. Yes. So here, so I have presses from underneath
Oh,
at the same
very
time.
cool.
Yeah.
That's
So
great.
here, so we're gonna spread right here, and so we're pressing from underneath at the same time as we're pressing from above.
I have felt the need for
It's
that.
burning.
Yeah, burning, right?
And then let's go with the little toe here, between the fourth and the fifth.
Now, when you don't press on it, you don't feel that pain, but believe me, it's there. Just because you don't feel it doesn't mean it's not communicating pain to your nervous system.
That's right. That's right. Latent trigger points are causing constant activation.
Yeah. A lot of nociception is beneath the
Awareness.
beneath awareness threshold. Exactly right. Oh, the blue pad. Sorry, it's just a tennis ball and a sock, isn't it?
Yes, that's it.
It's a sock and there's a ball in there.
So this is a sock with a ball in it.
So what's the blue pad?
Yeah. Well, this is nice. Sometimes it's nice to have two balls, you know. So maybe you could have different uses for two balls.
Oh, that's nice.
So here I'm getting the tendon of the hallucis right here. So I'm getting the tendon and getting all that fascia and skin. You want to make sure all the skin on the foot is really flexible. And all the fascia is really flexible. You get the toes to go in every direction. So I just want to make sure the second interossei is working really well.
Yeah, and then don't forget when you do the toes, those extensors and flexors extend. They attach all the way onto here. So little attachments points for the inner SCI here, and little
Yes, they go
extensor
all-
points all the way up there, and all the way down there.
So if you could do this to get all the attachments, if we could go like this, we'll squeeze top to bottom. We're going to squeeze side to side, just like that, and then we're going to squeeze in a diagonal and squeeze in another diagonal. So we're going to do that with each one of the toes. So squeeze top to bottom. Then we're going to squeeze side to side, and then you can feel the attachments right here.
Yeah.
Right there, and you can feel the because it's attaching there, the interossei is making the bone grow right there.
Yeah, you'll feel a little bump there. Yep.
Yep, right there. So we're going to go that way. Then we're going to go to diagonal.
And it's not hard to tell where the
And the
problem
diagonal.
spots are because they will hurt.
You feel
Right?
Everything's hurting.
Linda's not arguing there, right?
So we're going to
Yeah.
squeeze side to side. We're going to squeeze top to bottom, and we're going to squeeze diagonal and diagonal. And then this toe here, top to bottom.
So how about incorporating this into your little morning routine, right? Maybe get a little scrub, time in the bath,
That's
a
it,
little scrub,
that's a little
and
scrub.
work these feet until they don't
Well,
hurt
lots of
anymore
times
at all.
you can start with the bathtub hot, really hot
Yeah,
water. Get
yeah.
your feet in there, okay?
Yeah.
Get the feet started, then do the feet movement
Yeah.
as the bathtub is filling up, and then really get those feet. And I think it's just critical.
And it's exciting. I mean, aren't
You're
you?
excited.
Aren't you?
I was
you're
thinking like-
excited, right?
I was
mean,
thinking like Valium instead of coffee, or Flexeril or something.
No, it's just flexible. We
Yeah.
get flexible. We don't even need Flexeril.
yeah, flexible and strong. Yeah. Okay. Just look up the scrub company Renude, RENUDE.
Oh
Here
yeah,
it is.
that's a company, and they have little stores called what is the places called? Why can't I think of it?
Let's see if there's a website.
And
here.
I'm starting to get a cramp in the back of my
Okay,
foot.
there we go. Switch that.
Yeah.
Good. We shortened it.
Would they have
Sharon, are you able to get it on Amazon?
No.
Not
She
on
doesn't
Amazon?
sell it on Amazon.
She doesn't sell it.
Which
Trim. The stores are called Trim.
Trim.
Trim stores. And she sells it. She's got 5 stores in Chicago. Trim.
Well,
Where are you?
you'll be able to find it online. In the
At the Trim stores.
yeah,
There you
the
go.
trim
Yeah.
stores. Yeah.
Okay, so Let's see if how we did with our strength. Okay, so let's go ahead. Let's do a little bit of strengthening.
Okay, so
Let's check your strength.
this second toe, pull back up for me. It's still really spongy. So,
Okay,
so
so
what if that's more of the longest?
Let's go. Let's treat that again.
Let's treat the longest
let's
then.
Let's do it again. So let's do. Also, we'll do the flexor. Okay. So let's do the longest. So right here, or right on the longest. Feel that?
Oh yeah.
Yes, she feels it.
She feels it. Her eyes grow wide. And she goes, "Oh yeah."
So right on the longest there. And let's go shorten the longest.
Yeah, and
Lengthen
all the
a little.
tendons
Mhm.
around. You know, a lot of people right over the. If you had an ankle sprain right over the talar joint,
Mm-hmm.
then that may be a spot that's. It's
And
such a
let's
long
do the
muscle.
flexor. Okay. We'll do the flexor too. Okay. See how it is
Whoa.
after. Okay, here the flexor.
She's crawling off the
Okay.
table.
So here we're gonna put I'll put the flexor on the stretch. That one.
Oh,
There, that's a little better, right?
I guess not.
Oh my goodness, what the heck is that?
That's sometimes why you need a therapist. You sometimes can't cause yourself this much therapeutic
good.
love.
Okay, so it's good.
Yeah,
Okay,
it's
so
very
that's
good.
better. That's better.
Yeah, it's exciting to think that all those little toes are going to gain their strength back and their flexibility back. It's going to be great.
And then the little skin over the bone will soften up, and then stop pulling on the attachments on the bone.
Yeah,
It's gonna be great.
it's real exciting.
Super.
Yeah, I think that one needs a rest.
Needs a rest? No, it needs more
Okay.
work.
Okay, go ahead and press up.
Can you press up
Good,
at all?
good. That's good. That's good. And then press down. Ooh, that's good. That's
That
good.
was good. Yeah,
That
let's
was
try.
good. That's good. And inward. That was good. Oh, that's pretty strong. That's good. Okay, so that's a little stronger. You go ahead. You test
Yeah.
it. You test
Here.
it. Yeah.
Just push up here a little bit. Oh yeah, much stronger. Remember, it just
Yeah.
folded like a
Yeah.
potato
Yeah.
before.
Yeah, yeah.
Potato. What is a potato fold like? I don't
French
know.
fry.
I got potato fold. So right there.
A greasy French
So
fry.
you know she's going to have to do more work, really,
So-
to flush this
so-
out all the way down.
yes.
I mean, down here. Oh, you could just
So we
feel
can
it.
have you do the extensor longest right there,
Yeah.
and the flexor longest.
Sometimes where the tendons
And the
cross right
interosseous.
here.
Yeah.
Yeah, all the way into
Yeah.
that second toe.
So
Oh, you
we'll-
can just feel it.
Yeah, yeah.
Yeah.
But also it was good to do the flexor. You felt that, yeah.
Yeah.
Super.
Oh, and it might have been the flexor that really
Well,
turned it on too.
it did have a lot
Yeah.
of the flexor.
Yeah, you have to check.
Right in here, sometimes it feels
Yeah.
like I don't know, like the tendon is slipping or something.
That can be the
Uh-huh.
proneus tertius right in there too.
It feels like it kind of goes out of alignment sometimes.
Mm-hmm.
Because of course we'd want to do the pronei for any
I
any
feel this
sprain.
little dysfunction right here.
Yes, yeah.
So
what is that?
That's a little the retinaculum that's around the. I feel the little fascial retinaculum right there.
So let's see, spread these toes again. I'll try and squeeze them together. Spread them. Okay, so
Am I
I think
supposed to be spreading or squeezing?
Spread. So I think the interossei probably would need more work, but I can't believe how much better we got in the extension. Bring the toe
We
back.
did that, yeah.
Pull the toe
So
back.
what if we had
Oh yeah, it's so much better.
What if we
Good.
had one toe going over the other toe? So we
Yeah.
want to treat a lot of these same muscles we just treated. And
You mean like this, where one toe
yeah,
is like that,
yeah,
bent over?
yeah. So
like
we,
that.
then we want to treat all the interossei and all the flexors and extensors.
Yeah.
So at the beginning.
Yeah, my auntie had that where she had the bunion and then this toe was crossing over this
Yeah.
one.
Yeah.
And then, yeah.
Super. Okay, why don't you go ahead and let's have you go ahead and sit up and then stand up.
Okay.
Thank you. That was great. Really good demonstration.
Well, thank you. That was torture.
I know. It feels like it, but I mean, man, just think of it. The amazing thing about those points is they're so exquisitely painful, and then they just disappear. Like the pain,
Yeah.
like you get a hot rush, and then the pain is gone. It's almost like it wasn't
yeah,
there.
what we did was treat the flexor, just a teensy bit, bang, it made it strong.
That's true.
Yeah,
So
that was good, that was
remember,
good.
you check the synergists, which would be muscles like anterior tibialis and the flexor and the extensor digitorum, right? Those would be synergists, and then the flexors would be antagonists. So you have to check synergists, antagonists, and all that.
So should we take a look
Thank you.
at some of the other feet?
Sure.
Should we look at a few other feet? Okay. Okay, so let's see what we find on some of our
Sounds
other
fun.
feet here.
Yeah.
Fuzzy
Okay.
Okay, so So let's take a look at the anterior tibialis and the extensor and the interossei, some of our ones that we're working on.
Great.
Let's do the flexor of the great toe. Okay.
Yeah. Oh,
So
and
go
I
ahead and lay on your back.
I didn't show you the test for the anterior tibialis too, so we'll do
let's
the strength
that.
test for
Let's
that.
do that. But let's do the strength test for the anterior tibialis. Okay. Let's go ahead and try that.
All right.
Super.
These ankle muscles are so